Well, let's get an expert assessment of the spread of the COVID-19 virus and the implications for Canada. Dr. Susy Hota is the Medical Director of Infection Prevention and Control at the University Health Network in Toronto. She joins me now. Dr. Hota, thanks for taking your time. It's good to see you.
Thanks for having me.
When we hear about the spread of the COVID-19 cases around the world now and the challenges in trying to contain the spread, how concerned should we be here in Canada?
Well, I mean, certainly it seems as though things have escalated, especially over the last week or so. Right now in Canada, we still have very few cases, but of course, we're anticipating that may change. And so it's best for us to be thinking about how we can prepare ahead and be able to respond to that.
I want to get into that in some detail, but let's stay for a moment with the global picture. How do you assess the global efforts to try and contain this?
Well, I think, China really did try very hard to contain things. And, unfortunately, we continue to see spread outside of China. But it is a difficult thing to manage. One of the reasons being that people can have relatively mild symptoms when they're infected with this and not recognize that they have infection and maybe not seek medical attention. And so it becomes really difficult to track what's going on. I do think that quite a few efforts have been made, and most of them were very valuable in terms of trying to slow things down. But ultimately, viruses like this can spread, and we should be prepared for that possibility that it will continue.
Let's talk about that. I mean, is there a clear picture to you yet on what this outbreak might do next? Where could it go from here? And let's start globally, and then we'll talk about Canada. Globally, what do you think we watch for now?
Yeah, I mean, I think we're already seeing cases that are popping up that were exported from Italy, for example, through Europe. There's been a case now in Brazil. That's what we're going to be seeing probably in the next several days, up to a couple of weeks, is seeing more cases arising in areas that have not yet declared cases. The real question will be how many of those will take off and result in sustained transmission within those countries locally. And if we see that really pick up, then that's a sign that, we are indeed in a pandemic.
And I suppose, does some of that depend on which countries we're talking about? We're seeing some spikes in a number of different countries, Iran, for instance, perhaps without the kind of the same tools to diagnose it or contain it that other countries have. How concerned should we be about that?
Yes, I mean, there are several countries that don't have as much access to diagnostics, but that's only really part of the picture. The other concern is how well can they respond to a problem like this? Do they have the public health infrastructure to actually follow up on cases in the community and try to follow up on their contacts and contain it when it's in the early stages and you have that opportunity to contain it? And how are their hospitals prepared? What is the capacity of their hospitals, and what are their infection control policies to try and reduce transmission within healthcare settings? These are the questions that will determine how well a country is going to be able to handle this when it's introduced.
Let's talk about Canada. What's the likelihood of an outbreak of the disease in this country beyond what we've seen so far, the relatively isolated cases we've seen that are travelers returning to this country where they've typically picked up the virus outside of the country? How concerned should we be that we could see an outbreak here?
I think it's definitely a possibility and something that we're just planning ahead for this possibility. We do have a strong system in place in terms of public health knowing, what to do to trace people who have been diagnosed with this and their contacts. We've got strong infection control programs in hospitals. The challenge is, like I said, people not being aware that they may have been exposed as things are rapidly changing. And not coming forward with symptoms or coming forward with symptoms and not really recognizing that this could be the case or declaring their travel history and exposures. So, that's always something that we have to be aware of that can happen. So over time, as it becomes more widespread throughout the world, we will have to adapt our strategies to try and identify people who might have this illness.
But should we expect that it's almost a given that at some point we'll have a sort of person-to-person spread of this virus in Canada at some point, or can any way to protect against that?
I think it's looking less and less likely that we'll be able to stop that from happening as it increases in different parts of the world. It's hard to anticipate things. The outbreaks in other parts of the world sometimes are arising or being declared at a point where there's already been lots of community related transmission and people may have traveled from those areas already to Canada. So it's I think likely that we will see cases increase in Canada over time unless something drastic happens throughout the world.
And should Canadians, what level of confidence should Canadians have that we have a robust plan in this country to deal with if we do get an outbreak? How confident should we be that public health officials and people such as yourself have this plan ready to go that will protect the country?
I mean, we've been working on pandemic planning since the time of SARS, really, and recognizing how important it is to be prepared for another emerging infectious disease that can be transmitted in the same sort of way. But also, influenza pandemics we know have been, happening throughout history, and it could happen again at any point in time. So, hospitals have pandemic plans. Public health officials have developed pandemic plans at different levels, the national level, and those are evergreen documents. They're things that are being updated constantly. And so we have that basis that can be adapted for this scenario fairly quickly, I think, as we learn more and more about how COVID-19 is behaving. One of the challenges is that we still don't have all those answers about how it is clinically and epidemiologically behaving. So, it's like I said, a process, but we do have the foundation in place already.
The World Health Organization, and we'll wrap up on this, is still refusing to call this a pandemic. Do you support that approach?
Yeah, it's a bit of a judgment call. I think we all recognize that things have escalated. And frankly, the declaration of a pandemic gets everyone on the same page. And so it's helpful in that respect. But there's nothing stopping different countries from actually going ahead and planning for the kinds of measures that you might need to pull out if this becomes more widespread in your community. In fact, I think this is a good opportunity for us to be doing that, dusting off our pandemic plans, thinking about what we need to plan for moving forward. So whether you declare it a pandemic or not, I don't think it changes the way that people ought to respond at this point.
Right, but what would change, I guess, in the response, not just in this country but globally, if the WHO does declare a pandemic? What would be different?
Well, I mean, like I said, I think it makes that statement that we should be going from less of a contain every case kind of modality of response to let's mitigate, recognizing that there will be transmission within the community. Let's reduce that risk to people. Let's take out measures like social distancing, which we haven't put into place here yet because there is not a reason to do so. But if we suspect that there is going to be more community spread here, then trying to get people to avoid being in large congregations, for example, having to close down areas or schools, for example, or places where people tend to be crowded and infections can actually spread more rapidly. Those kinds of measures, we're not at a point where we need to institute that, but you can look ahead and start planning for that. And when you declare something a pandemic, that's the kind of thing that in the public health arena you think about.
And would this be a time we heard the health minister say today that, look, it's not a bad idea for Canadians to prepare for that possibility. I suppose stock up on medication that you might need if you find yourself, limited to your house for a couple of weeks. Is that same kind of advice you would give, that, look, it could be coming, so get ready?
Yeah, I mean, I think that for the public, the most important thing is really recognizing some things that sound kind of mundane, but are really important for protecting your own health. Washing your hands really frequently. Try not to touch your face. And if you become sick with a respiratory illness, stay at home and take care of yourself and don't expose others to your illness. I mean, those are basic things that I think are important for people to think about. Whether you need to stockpile food or medications or, other supplies at home, I don't think that we're at a point where people need to panic and do things like that at this point in time, but you should be thinking ahead about what your needs are, and I think that's fine. Really, the focus is on places like where I work in hospitals for us to be preparing, because it takes time to get preparations in place to deal with increased volumes of patients, for example, and make sure our supplies are here to care for the ill, and that all of our protocols are functioning well and people are feeling well supported to actually do their jobs. That, I think, is really what the focus is at this point in time. And for us to mobilize the resources to actually support that kind of work is really important.
Dr. Susy Hota, thank you for your perspective tonight. Great to talk to you.
You're welcome.